Hello and welcome to another session of Careers in STEM. And today we'll be talking about healthcare and medicine. So we've all been to the doctors before and we know what a physician does. And so basically, this slide is telling us that healthcare is the maintenance or improvement of health through the prevention, diagnosis, treatment, recovery, or cure of disease. And so, as a healthcare provider, your role basically is to maintain or improve the health of your patients. Okay. So, what are the typical majors for students who want to pursue careers in healthcare? It is a widely held conception that you have to major in science, especially a biological science like biology. But that is actually not the case because you can major in pretty much whatever you want as long as you complete the prereqs for your professional school of choice. And so, for in medicine, for example, you have to complete prereqs like two classes of biology, two entry chemistry classes, two organic chemistry classes, two physics classes, a biochem class, an English class, and a math class. So if you get those prereqs completed, then you can, major in whatever you want. And in my opinion, I think majoring in something outside of the typical majors for pre-med students or pre-health students sets you apart because, let's say, for example, you were a dance major. You can talk about what it's like to be a dance major in your medical school interview, and that sets you apart from the typical applicant. So listed here are typical majors that pre-med or pre-health students usually pursue. So you have biology, nursing, microbiology, chemistry, biology, biochemistry, psychology, public health, and biomedical engineering. Sometimes you find some math and physics majors in there as well. Okay. So career fields in healthcare. So I went ahead and made a list of some career areas in healthcare, the major ones like medicine, healthcare support, nursing, pharmacy, and psychology, and public health. And so I went ahead and broke down each area into specific specialties and positions. And so today I will be mostly talking about medicine because it pretty much encompasses areas that a lot of these other careers specialize in. So some specialties in medicine, as is listed here, are allergy and immunology, which takes which deals with patients that have allergies or have allergic reactions to different things. Anesthesiology, which are the doctors that put patients to sleep for surgery. Colon and rectal surgery, which are doctors who perform surgery on the digestive system, the colon and rectum, and all that good stuff. The dermatologists that take care of the skin. Emergency medicine doctors, which is what I want to pursue. They take care of patients who are experiencing physical trauma. That could include an accident, a gunshot wound, all that stuff. In family medicine, they take care of pretty much everyone in the family. So they get to see a wide array of patients. So they see patients from all different ages and all different backgrounds, as long as, yeah, they see pretty much everyone. And in internal medicine, this is area of medicine that deals with internal systems of the body, like the circulatory system, the respiratory system. So doctors that practice in these, that specialize in these areas, are called internal medicine doctors or internists. You have medical genetics, where in this area doctors advise and counsel patients who are looking to have children on genetic disorders that could potentially arise from the family medical history or family genetic history. You have neurological surgery, which is neurosurgeons that perform surgeries on the brain. Nuclear medicine, so doctors that deal with patients who have been exposed to radiation of different doses. Obstetrics and gynecology, they deal with pregnant women. Ophthalmology, doctors for your eyes. Orthopedic surgery, these are doctors that perform hip replacement and knee replacement surgeries. Otolaryngologists are the doctors of the respiratory airways, like your nose, mouth, throat, larynx, pharynx, all that good stuff. Pediatrics, these are doctors for children. Plastic surgery, these are doctors that perform plastic surgery. Psychiatry and neurology, these are doctors that deal with mental illnesses. Radiologists look at x-rays and MRI images. Thoracic surgery, they perform surgeries on the thorax, which is, I believe, from your diaphragm up to your neck. And that area encompasses that area contains your lungs, your heart, and all the fun nerves and lymph nodes and whatever that go on there. And that was thoracic surgery. And you have urology, which are doctors that take care of the excretory tract, specifically the urinary tract. So they look at your kidneys, bladder, and yeah, ordinary docs and whatnot. And then veterinary doctors, which are doctors that look after the pets and your animals. Okay, so that was it for medicine, and then we move on to healthcare support. So healthcare support, these are staff that pretty much assist the physician in performing their duties. They ensure the smooth running of healthcare, in my opinion, and a lot of them tailor their practice to the specialties of different doctors. So you have physician's assistants, dental assistants, audiologists, athletic trainers, surgical technologists, and MRI technologists. And you also have EMT and paramedics. So these are people who take patients who are experiencing physical trauma or emotional trauma, whatever it may be, to an emergency room to be treated by an ER doctor. So there are a couple careers under healthcare support, and the main thing to take away is that they ensure the smooth running of healthcare, and they assist the physician in performing their work duties. Then you have nursing, our awesome nurses. So nursing, much like medicine, has several specialties. And so nurses can also specialize just like doctors do. So you have neonatal nurses that take care of newborns, nurse midwives that assist OBGYNs in delivery, clinical nurses that perform in the clinic, nurse advocate, nurse researcher, pain management nurse. And so a lot of the names are pretty self-explanatory. And geriatric nurses are nurses who work in nursing homes that look after the aging in our population. Then we'll move on to pharmacy. And believe it or not, there are different types of pharmacists. You have community pharmacists, hospital pharmacists, clinical, industrial compounding. Industrial compounding, I believe, are pharmacists that work in pharmaceutical companies that develop drugs. Then you have ambulatory care, regulatory, and home care pharmacy. So a lot of it is pretty self-explanatory in the name. So the takeaway is that there are different kinds of pharmacy. And you just have to, when you I guess get into pharmacy school and you begin to do your rotations and clinicals, you start getting a feel for all these areas, and then that's when you decide to specialize in whatever field you'll be specializing in. Then you have psychology and public health, and so these are your therapists, counselors, social workers, and geropsychologists. Geropsychologists are psychologists that study the psychology of aging and of old people. And then you have special education epidemiologists, which we have to we owe our lives to technically during the current situation with the pandemic. We have medical sociologists who study the relationship of people with medicine, how the people relate with healthcare professionals, and they usually do these studies in terms of specific populations, so they could study a specific income bracket, a specific race, age, gender, sexual orientation. They do a lot of research. I have the pleasure of working with one of such medical sociologists this summer, and he's doing research on how do people relate with doctors, and so it's been awesome. Then you have health education, community service management. So these are your community service organizers, and then public health researchers, that do research to study, let's say, pollution or opioid outbreak in specific areas. Okay, so that was pretty much it for the careers in healthcare. I know I didn't talk specifically about every single one of these careers, but you can go ahead, and if any of these interest you, you can look them up or shoot me an email, asking a question, and I'll be sure to answer you. I'll leave my email in the description under this video, so yeah, you can just hit me up. Okay, so what does professional school look like? So professional school, we know that is what you attend if you want to practice medicine or if you want to go into healthcare. There's more education beyond the 4-year undergrad level. So for medicine, it is 4 years of medical school after your undergrad. And after that, you have 3 to 4 years of residency, which is practice after medical school. So you practice what you learned in a hospital setting under the supervision of other senior doctors. Then you have 1 to 3 years of fellowship depending on your specialty. So for something like neonatal care, you have about 2 years of fellowship after your residency. And then for neurosurgery, for example, you have up to 5 years of residency. So it can take you 11 years after your undergrad. So in total, about 15 years to actually begin to practice as a neurosurgeon. As a neurosurgeon. And this is because you're working with a very delicate organ. It's the brain. It's very complex. It's very delicate, and you need all the training that you can get to be able to, before they release you onto the population to practice. So that's for medicine, and then nursing. Nursing is much shorter. You can get an associate and begin to practice as a registered nurse, or an ADN. Yes, that's what the degree is called. But a person who works with an ADN is a registered nurse. And then if you get a bachelor's of science in nursing, you can do your six to 12 months of residency and become a nurse. And then for a therapist, you have about a year of master's degree after your undergrad, or you can go ahead and get a PhD. And that allows you to teach other incoming therapists. Okay, so what is the earning outlook for healthcare careers in Texas? So I went ahead and did some research, and I was able to pull up some numbers. And according to the slide, we have nursing. The average hourly pay of a nurse in Texas is 35 dollars rather. And this data is from the Bureau of Labor. Yeah, it's a pretty cool resource. So you can just check it out if you're curious about earnings in any part of the United States. So in Texas, nurses make about 35 an hour with 74,000 a year. In medicine, doctors typically in Texas apparently make an average of $96 an hour and a 200 a year. But I've seen doctors make up to 600. But then again, keep in mind that this depends on the specialty, and it depends on the state. Okay. So specialties like dermatology, they usually make. I've seen dermatologists make up to $600,000, and plastic surgery as well. They make a lot of money because they do really expensive procedures, and people want to look good, and they want to spend money to look good. So these doctors, do tend to make quite some money. And then you have therapists. Therapists make about $30 an hour with an average of $66,000 a year. And keep in mind, this is not just steer you in a certain direction because of the money. You're gonna pick what career you're interested in based on your goals and what you see yourself doing in life. Money sometimes is a motivator for people to pursue certain careers, but that shouldn't be your absolute driving force in life. It doesn't make for very happy people. Anyway, so therapists, $30 an hour, $66,000 a year. Then healthcare supports an average of $15 an hour and 32 a year. But keep in mind that this earning for healthcare support is mostly collected from data from about EMTs and paramedics. So other healthcare support staff, like physician's assistants, they make a little higher. They make up to $70,000 a year. Yes, they make up to 7,000, over 70,000 to be honest, a year. But the specific number right here is mostly from the techs and EMTs, paramedics, firefighters, all that good stuff. Okay, so that was pretty much it for the earning outlook in Texas in terms of healthcare professionals. Now let's look at a schedule from a pre-med major, or biology major pre-med track from UNT, and which happens to be yours truly, me. So this is my schedule from this upcoming fall semester. And I will be taking, like as the schedule says, cell biology lab, biochemistry lab, physics lab. It's a lot of labs. I'm taking 3 classes and 3 labs, and all together they make 12 credit hours because classes are 3 credit hours and labs are 1 credit hour each. So this is pretty much what your schedule will look like as a pre-med major or biology major, especially if you are taking a biological science like I am. And so as you see, some of my classes are Tuesday, Thursdays, Tuesday, Thursdays, or Mondays and Wednesdays, and then these are only once a week, which are my labs. My labs are once a week. Classes are either Tuesday, Thursdays, or Monday, Wednesdays. Sometimes you have Monday, Wednesday, Friday classes, and it depends on the class. So I went ahead this time and made my schedule to be not so early. I've had in the past classes that start at 8 a.m. every single day of the week, and it was a struggle waking up for those classes. So I learned my lesson, and this time my classes started a little later than 9 a.m. rather. So that's pretty much it. That's pretty much all I had for you in this session, and I will see you next time. Stay safe, stay hydrated, stay cool, and see you next week.